You are a Foundation 2 doctor on a general surgery rotation. You and another F2, Alex, are working together on the ward and are dividing the jobs generated during the ward round. After a few weeks, you notice that Alex consistently chooses the quicker and simpler task, leaving you with the more time-consuming and complex ones. You later find out that Alex is using the free time he gains in the afternoon to study in the library for his upcoming MRCS Part 1 examination. Rank the following actions in order of appropriateness in response to this situation. Option A, seek advice from another SHO. Option B, report your concerns to Alex's educational supervisor. Option C, discuss the distribution of jobs with your educational supervisor. Option D, complain to the general surgery consultant, Mr. Blunt, about the pattern you have identified. Option E, speak with Alex about your concerns regarding the unfair burden of jobs. You can pause the video now and write your own answer. The correct answer is ranked as follows. This question tests your understanding of conflict resolution and teamwork. The first approach in conflict resolution, according to the General Medical Council, is direct contact. This means that you should try airing your concerns to the party involved, which is Alex. So option E is the best answer. Speak with Alex about your concerns regarding the unfair burden of jobs. The next best answer is option C. And it is discuss the distribution of jobs with your educational supervisor. Your educational supervisor is usually a consultant in the same hospital and sometimes could be in the same department. They are usually appointed to guide and oversee junior doctors as they learn. In this case, you seek his help because he has been appointed to guide you and to oversee you during your training. The next best option would be A, seek advice from another SHO. It is also seeking advice, however, it is less appropriate as the person you are seeking advice from is a fellow junior doctor with little experience and may not know more than you. However, it is better than option D and A, which is the same as reporting your colleague and may strain your relationship and cause conflict within the team. Option D is the next best answer. Report him within the same department to an overseeing consultant who can easily resolve the issue, although it risks straining your relationship with your colleague. The reason why this ranks lower than discussing with fellow SHO and discussing with your educational supervisor is because it can be seen as reporting your colleague, and this might strain your working relationship with Alex. The last option and the least favorite option is option B. It takes the issue too far as it involves your colleague's educational supervisor, who in most cases will be from another unit and knows nothing about the department. It is an unnecessary escalation and also a waste of time as it is unlikely to help resolve an issue in your unit. So again, this falls under the jurisdiction of reporting your colleague. The best person to resolve this issue should always be with Alex and then with your educational supervisor, who is an experienced consultant that can guide you on the best step to take. You are a Foundation Year 2 doctor on the respiratory ward. Mr. Smith, a 63-year-old man who has been admitted with pneumonia, approaches you appearing upset. He reports that your IMT3 colleague, Dr. Joseph, has spoken to him in a dismissive manner twice this morning. From your experience, Dr. Joseph has always had a pleasant manner with patients and colleagues alike. Choose the 3 most appropriate actions to take in this situation. A. Ask Mr. Smith what he would like you to do with his concerns. B. Explain to Mr. Smith that Dr. Joseph is an excellent registrar. C. Reassure Mr. Smith that Dr. Joseph would not have meant to cause offense. D. Apologize to Mr. Smith that he feels upset by these encounters. E. Give Mr. Smith the details of the PALS department and explain the process of making a formal complaint. F. Explain to Mr. Smith that the ward is understaffed and the team is working under high pressure. G. Tell Mr. Smith to discuss any concerns with the consultant, Dr. Amit. And the last option is explore the situation further with Mr. Smith. You can now pause the video or the audio and write your own answer. The correct answer is A, D, H. A. Ask Mr. Smith what he would like you to do with his concerns. D. Apologize to Mr. Smith that he feels upset by these encounters. H. Explore the situation further with Mr. Smith. To understand this scenario, it is about the importance of professional conduct and patient-centered care. The General Medical Council highlights the importance of treating patients with respect and addressing their concerns promptly. Apologizing to Mr. Smith for his feelings, option D, and addressing their concerns acknowledges his emotions and ensures he feels listened to and validated, aligning with the GMC guideline. Asking Mr. Smith to elaborate on his concerns, option A, fosters open communication and enables a better understanding of the situation. This also ensures he feels listened to and gives you further information in case escalation is necessary. Similarly, offering Mr. Smith the choice of how to proceed, A, respects his autonomy and promotes collaboration, which is an important part of working in partnership with patients. However, suggesting the formal complaint procedure, option E, is premature without Mr. Smith expressing interest. Expressing personal concerns about personal opinions about Dr. Joseph, option B, risk undermining Mr. Smith's concerns. Additionally, discussing workload pressure, option F, is irrelevant to the patient's immediate needs and appears to be an excuse for potentially inappropriate conduct. Advising Mr. Smith to address the issue with the consultant, option A, is premature unless he wishes to escalate the matter further, and it also neglects your personal responsibility to help resolve this matter.